Bloodborne pathogen training for Fairbanks North Star Borough School District employees. Whether in the classroom, on the playground, or on the playing field, students experience cuts, bruises, and other injuries. Therefore, all school employees must know the potential danger of bloodborne pathogens. Guidelines have been developed by the Occupational Safety and Health Administration, also known as OSHA, that can protect you from bloodborne pathogens. These guidelines outline a method for you to follow in order to substantially reduce the risk of contracting a bloodborne disease while on the job. It's important that every school employee understands the dangers of infection and safe practices to minimize risk. OSHA tasks all employers with creating a bloodborne pathogen exposure control plan. This plan must include a variety of items, including which employees have an occupational exposure or risk of exposure to bloodborne pathogens, steps to prevent exposure, and what to do in case an employee is exposed. Methods to prevent exposure. These are typically called engineering and safe workplace practices. How to report an exposure incident. The district's bloodborne pathogen exposure control plan can be found on the district website at this URL. Who is covered by OSHA's bloodborne pathogen standard? Well, all employees who could be reasonably anticipated to face contact with blood or other potentially infectious materials as a result of their job duties are covered under this standard. This includes all educational staff. The district's bloodborne pathogen exposure control plan outlines which employees are offered the Hep B vaccine upon employment. If you are in one of the positions listed below and want further information on the Hep B vaccine, please contact your school nurse or the Director of Nursing Services. Why is a bloodborne pathogen standard needed? There are many bloodborne pathogens that can have long-term chronic implications. According to the Centers for Disease Control and Prevention, Hep C is the most common chronic bloodborne infection in the U.S. Staph infections, while not covered in detail in this training video, can be prevalent and spread quickly in gyms, athletic arenas, or any place where a group of people convene. It is estimated that 1 milliliter of blood can contain over 100 million infectious doses of Hep B or Hep C. Therefore, OSHA's bloodborne pathogen standard prescribes consistent, universal safeguards to protect workers from exposure. What are bloodborne pathogens? Bloodborne pathogens are infectious microorganisms found in blood that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, hepatitis C, and HIV. There are also many other bloodborne pathogens not covered in this training. Workers in many occupations, including school district employees, may be at risk for exposure to bloodborne pathogens. Hepatitis B causes serious liver disease, which can become a chronic condition that causes permanent scarring of the liver, leading to liver failure or liver cancer. There are an estimated 2,000 to 4,000 deaths per year in the U.S. related to Hep B infections. 50% of infected people are unaware that they have the Hep B virus. Symptoms include fever, fatigue, loss of appetite, nausea, abdominal pain, and jaundice. Up to 40,000 people in the U.S. will become newly infected each year. The Hep B virus is particularly dangerous because it can survive for at least 1 week in dried blood on environmental surfaces or contaminated needles and instruments. Hepatitis C is the most common chronic bloodborne infection in the U.S. Symptoms include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, joint pain, and jaundice. Hepatitis C attacks the liver and leads to inflammation. A chronic infection develops in 75 to 85% of patients, with 70% of those people developing active liver disease, which can result in long-term health problems, even death. Approximately 3.2 million people are infected in the U.S. Most have no symptoms and don't know they are infected until decades later, when liver damage shows up in routine tests. The human immunodeficiency virus, known as HIV, causes acquired immunodeficiency syndrome, also known as AIDS. It attacks the immune system cells, weakening and eventually destroying the immune system, leaving the body at higher risk of developing more serious conditions such as pneumonia or cancer. Nearly 7,000 people died from HIV or AIDS in the U.S. in 2013. It is estimated that more than 1.1 million people are living with HIV. Of those who are infected, approximately 1 in 5 are unaware they are infected. Once infected, the human body cannot get rid of the HIV virus completely. A person is infected for life. Some people experience flu-like symptoms 2 to 4 weeks after infection, while others may not feel sick at all for a long period of time. HIV does not survive long outside the human body and cannot reproduce outside a human host. According to the American Red Cross, bloodborne pathogens spread primarily through direct contact, which means infected blood or body fluids such as mucus from one person is transferred directly to another person. Indirect contact. This occurs when a person touches an object that contains the blood or body fluid of an infected person. There's also respiratory transmission. This happens when a person inhales respiratory droplets from an infected person, such as through a cough or a sneeze. And then there is vector-borne transmission. This occurs when a person's skin is penetrated by a bite or other means from an organism carrying the disease. This includes bites from children. School district employees incur a risk each time they're exposed to bloodborne pathogens. Any exposure may result in infection and subsequent illness. Since it is possible to become infected from a single exposure incident, these incidents must be prevented whenever possible. In many work situations, transmission is most likely to occur because of accidental punctures from contaminated needles, broken glass or other sharps, custodial or maintenance work where universal precautions are not being followed, contact between broken or damaged skin and infected body fluids, or contact between mucous membranes and infected body fluids. For example, if someone infected with Hep B cut their finger on a piece of glass, and then you cut yourself on the now infected piece of glass, it is possible that you could contract the disease. Anytime there's blood-to-blood contact with infected blood or body parts, there is a slight potential for transmission. Unbroken skin forms an impervious barrier against bloodborne pathogens. However, infected blood can enter your system through open sores, cuts, abrasions, acne, and any sort of damage or broken skin such as sunburn or blisters. Exposure can and does happen in the school setting. Anywhere there are children, there will be bloody noses, cuts and scrapes from playground and sports injuries, and sick stomachs. Children aren't always the best hand washers and aren't even aware that they have contaminated a desktop or keyboard. Accidental injuries can and do occur where students are exposed to sharp objects. Safety precautions are important to keep this risk of accidental injury to a minimum. Students are at increased risk for contracting infectious diseases because they are grouped together on a daily basis and expose each other to many new germs. Others have personal habits that can spread germs, which include thumb-sucking, rubbing their eyes, not washing their hands, and have runny noses. Students can get paper cuts, scrapes, or other oozing cuts. Some may bite or are the victims of biting. They may have rashes, acne and pimples, or nosebleeds. Many may have poor hygiene habits, and some may not have complete control of their bodily fluids. Special education employees should take extra caution while working with severely disabled children. Some children may be more vulnerable to injury, likely to have special medical needs, be dependent on adults for personal care. Always use personal protective equipment when handling any bodily fluids and wash your hands immediately afterwards. Reducing your risk of exposure to bloodborne pathogens means you need to do more than just wear gloves. To protect yourself effectively, use workplace practice controls. Wear personal protective equipment. Wash your hands, maintain your personal hygiene, and get the hepatitis B vaccine. These strategies will help prevent your risk of exposure to bloodborne pathogens and other infectious diseases. Guidelines from national and international infection prevention and control organizations have repeatedly acknowledged that hand washing is the single most important procedure for preventing infections. The components of good hand washing include using an adequate amount of soap, rubbing the hands together to create some friction, and rinsing under running water. The mechanical action of washing and drying removes most of the transient bacteria present. You should wash your hands before and after contact with injured or ill students, before and after changing diapers on students, whenever you remove gloves, before and after the use of the bathroom, prior to and after meal breaks, and after coughing or sneezing. Personal protection equipment. First aid kits, gloves, and other protections will be made readily available to staff members when needed. Gloves must be worn when any staff member may have contact with blood or other potential infectious diseases. Disposable gloves shall not be washed or decontaminated for reuse. Gloves shall be replaced as soon as feasible whenever their ability to function as a barrier becomes compromised. By following the general rules below will help you control your exposure to bloodborne pathogens. Clean and decontaminate all equipment and surfaces as soon as possible after contact with blood. Never pick up broken glass with your bare hands. Place contaminated sharps and infectious waste in designated containers. Garbage receptacles that have been contaminated should be inspected and then decontaminated. When a school district employee experiences an exposure incident, he or she must institute the required follow-up procedures in the Bloodborne Pathogen Exposure Control Plan. The first step is decontamination. The employee should immediately begin the decontamination process by washing the exposed bodily area with an antiseptic soap and water. Secondly, report the exposure to your supervisor or school nurse. Complete the Bloodborne Pathogen Exposure Incident Form and the Report of Occupational Injury or Illness form. More in-depth information can be found on the district's Bloodborne Pathogen Control Plan. Scenario number 1. After school, Mrs. Jenkins stopped in to visit her daughter's teacher, Mr. Hughes. In the course of the conversation, Mr. Hughes mentioned that Ciara had a severe bloody nose in the classroom. Mrs. Jenkins was a little alarmed and asked Mr. Hughes if he assisted Ciara and if he used gloves. Mr. Hughes stated he gave Ciara several tissues and those were thrown in the trash. Mrs. Jenkins then asked if Mr. Hughes was aware that Ciara was positive for Hep C. She stated that it was very important that all safety precautions were taken with any of Ciara's blood. Mr. Hughes was mortified. After the meeting, he went directly to the nurse to ask why he didn't know a student was Hep C positive and wanted to let everyone in the building know that Ciara was Hep C positive. Can Mr. Hughes tell all the staff members that Ciara is positive for Hep C? Answer. Ciara's medical condition poses no threat to anyone in the building as long as universal precautions are utilized. These precautions include using gloves when any bodily fluid is present and then immediately washing hands with soap and water. Mr. Hughes may not disclose Ciara's or anyone else's medical condition due to HIPAA regulations. There are many other bloodborne pathogens in addition to the ones covered in this presentation. It's extremely important that you always follow universal precautions such as wearing gloves when handling any materials contaminated with bloodborne pathogens and immediately washing your hands with soap and water. Scenario number 2. For her blood typing lab, Ms. Bex uses lancets and alcohol pads for pricking fingers. The sharps then need to be disposed of properly. What is the best course of action for Ms. Bex to dispose properly of the lancets? Does Ms. Bex need to dispose of the alcohol pads in a regulated waste container? Answer. As a courtesy, Ms. Bex should make the school nurse aware that she will need to dispose properly of the lancets. The lancets need to be disposed of in a sharps container. While sharps containers are available in the nurse's office, this might not be the best option for disposal, especially if the nurse is not available on lab day. Sharps containers are stocked in the district central warehouse and can be purchased through normal purchasing procedures. Alcohol pads, even if they contain visible blood, can be disposed of in the regular trash. Custodians are responsible for the proper disposal of all biohazardous materials. Scenario number 3. Jody, a 6th grader at Hunter, lost one of his back molars during class. His teacher gave him a wad of gauze to bite on to staunch the flow of blood. How should the wad of gauze be disposed of? In the regular trash can? In a regulated waste container? Answer. This answer is a little tricky. First of all, Jody's teacher should use universal precautions, including wearing disposable gloves. The determination of the existence of regulated waste is not based on the actual volume of blood, but rather on the potential to release blood. For example, a pool of liquid in the bottom of a container or dried blood flaking off during handling has the potential to release blood and should be disposed of in a regulated waste container. Examples of items that can go in the regular trash bag include bloody tissues and Band-Aids. Only items that are saturated with blood, where the blood can drip or leak out, need to be put in a red bag and disposed of properly by custodial staff. Implementation of OSHA's Bloodborne Pathogen Standard will protect educational staff against exposure to infectious and communicable diseases and significantly reduce your risk of contracting bloodborne diseases. For more information on protecting yourself and others from bloodborne pathogens, contact your school nurse or the district nursing supervisor at extension 11253. More information is also available on the district's bloodborne pathogen exposure control plan, located at this URL.